Dr. Dineshwar and all those who are participating in Hindi session. Good morning, good afternoon, and good evening. Welcome to the 1307th day of continuous and uninterrupted Zoom session of IFPH. Let us start today's program with a silent prayer for 1 minute. Thank you. Today we have with us Dr. VIJENDRA KUMAR PRATAP SINGH, BHMS, Director, MD, Homeo Private Lab Private Limited, Ghazipur, UP, a most popular practitioner of Ghazipur, Uttar Pradesh. The topic is utility of therapeutic approach in homeopathy. We all know that the therapeutics homeopathy is the richest therapeutics in medical science. I think that much credibility and quality is there. A lot of publications and almost all types of symptoms and diseases were covered. It was well proved during the COVID epidemic. So on behalf of IFPH, I welcome Dr. VIJENDRA KUMAR PRATAP SINGH. You can have the platform for the next 45 minutes. It's over to you. Please proceed.
Thank you very much, sir. I'm audible, sir?
Yes.
Okay, thank you. It's my privilege and honor that I've got this opportunity to deliver my presentation in front of you all intellectual people who are present in this Zoom meeting. I would like to especially thank to Dr. M.K. Sani, sir, who is continuously and frequently giving me wonderful opportunity. I also want to thank Manoj, sir. And I want to admit one thing that continuing organizing such type of webinars since last 4 years continuously without having any interruption, that is really commendable. So I would like to congratulate all the people in the jury. I would like to congratulate all the people who are present in the management. So thank you very much, sir, for organizing such type of programs, such type of webinars continuously without having interruption. That is really amazing. Friends, Earth is a single planet in this whole universe, single known planet in this whole universe where life is present. And when we talk about the other thing, that there is air. In air, as you all know, that there is oxygen in abundance, there is nitrogen, there is carbon dioxide, and all the other essential gases which are, important for life. There is water in the form of ocean, in the form of rivers, in the form of pond, in the form of glaciers, and also water coming from the root of the trees coming from the mountains. There are mountains, there are forests, there are wonderful landscapes. Everything is very much close to the nature. Anything which is close to the nature is close to the heart and soul. And anything which is close to the heart and soul is close to the God. And as far as homeopathic system of medicine is concerned, I think homeopathic system of medicine is close to the God. And that's why I want to repeat a quote given by me. Whenever I've got opportunity to deliver my presentation in seminars and webinars, I have always quoted, I have always given this quote, that lower center refer the case to the higher center when needed. Higher center refer the case to the best center when needed. Best center refer the case to God when they become fail, when they become helpless, when they say that we are living to the God. What will happen? God will decide. And friends, God refer the case to homeopathy, and homeopathy treat that case. That shows the efficiency, that shows the strength, that shows the power of homeopathic system of medicine. But what is the need of telling all these things in front of you, in front of your intellectual people? What is the need? The need is to make you know about the expansion of homeopathy. The need is to make you understand that homeopathy is expandable. The need is to make you know about the scope of homeopathy. The scope is limitless. So what we have to do? We have to come together, because for a single person, it is impossible to explore the scope. We have to come together in bulk. We have to come together in more than 1,000 number. We have to come together and making a feast and breaking the wall. So what is behind the wall? Behind the wall, there is concealed portion of the scope of homeopathy, and we have to reveal the concealed portion of the scope of homeopathy. And for that, we have to come together. We have to share our experience, exactly what we are experiencing in our clinic. We have to free from hyperbolism. And all these things I have already mentioned in my past presentations. Friends, I want to make you know that in today's arena, in today's scenario, clinical materia medica is important. And thousands of doctors, if come together, we can write a book, a thickest book in the world ever written, a book having 10,000 pages. So we need to share our experience, and this platform is not opportunity. More than that, this platform is a responsibility for me. And that's why I'm here in front of you. Friends, my expertise is a role of therapeutic in clinical practice. And I'm just a drop in an ocean. I've told you in the previous lecture that therapeutic is like billions and billions of galaxies, and we are living in a small planet. So you can think how enormous therapeutic is. So today's presentation, it's going to be a very fast-paced presentation. You have to be attentive. And the first case which I'm going to show you is gynecomastia. Gynecomastia is one of the common problems in clinical practice. And unfortunately, we don't have a proper treatment for gynecomastia, because when gynecomastia come during puberty, in more than 85% of cases, gynecomastia resolves spontaneously. There is no need of medicine. But when gynecomastia come at adult age, when a person come to you suffering from gynecomastia, and if the age is above 20, above 25, then the treatment is which really challenge you, that give medicine, just treat me. So the first case which I'm going to show you, a case of gynecomastia. Have a look on this. If you look at the case, you can see there is lateral displacement of the nipple, lateral displacement because of enlargement of the breast. And if I talk about the age of that patient, the age was 30 years. And when patient came to me, he was very hopeful. He told me that, doctor, please do something. Please do something. So I have given him the medicine. And if you see the follow-up, just look at this. You can see the medial, returning of the nipple. If I'm talking about the left side of the breast, just see the left side of the breast. And if I talk about the percentage of recovery, it is 40% recovered, 35 to 40% recovered within 40 days. Within 40 days. Have a look at this. More improvement. The nipple which were shifted laterally in the beginning, you can see they have returned back to the middle portion. And the swelling which you could see in the previous slide, now you can see that there is 35 to 40% relief. If I talk about the right side of the breast, 10 to 15% relief. But if you see the left side of the breast, great amount of relief. Friends, what medicine which I have given? But why I'm going to show you the incomplete case? I have to show the full recovery, but why I'm showing you the incomplete case? The reason is this. During my last presentation in the same platform, during the question answer session, a doctor told me that, doctor, will you please tell me about medicine for gynecomastia? So I told him that in 2 or 3 cases, I have got the result, and I have given pulsatilla 10 mg every 4th day. And suddenly, a senior intellectual doctors told me, sir, I also use a lac-human in a 10 mg potency. I use lac-human 10 mg single dose in cases of gynecomastia. So when I returned to my clinic next day, I immediately ordered lac-human 10 mg, but unfortunately, I did not get lac-human in a 10 mg potency. But fortunately, I have got lac-human in 1 mg potency. So in this case, I have given Lac-Human 1 m every 10th day and Pulsatilla 10 m every 4th day. Within 40 days, you have seen the result. But I want to ask a question from myself, that why I'm showing the incomplete case, because the medicine Lac-Human is a new medicine which I have started using in cases of gynecomastia. And I also want you people to use these two medicine in cases of gynecomastia, so that after 6 months to 1 year, we will have a conclusion regarding effectivity of Pulsatilla and Lac-Human in cases of gynecomastia. That's why I'm telling. So why Pulsatilla and Lac-Human is given in cases of gynecomastia? What's the reason? The reason is, if we talk about the symptoms of Pulsatilla, bashfulness. Bashfulness is one of the prominent feature of Pulsatilla. And if you see person suffering from gynecomastia, not a single person will want to show his chest in front of so many people, in front of while having a bath, enjoying in a water park, or having a bath in front of so many people. Not a single man suffering from gynecomastia will show his breast. So there is bashfulness. Bashfulness is present in a person suffering from gynecomastia, and bashfulness is also there present in Pulsatilla. And in the patient suffering from gynecomastia will also see the symptoms of Pulsatilla, like female type of behavior in walking, in talking, in softness, everything. That's why Pulsatilla is indicated. And what happens in gynecomastia? There is female type of breast there in male. That is gynecomastia. That's why Pulsatilla is indicated. But why Lac-Human? Why I have selected Lac-Human? Because Lac-Human is indicated because Lac-Human is prepared from human milk, human breast milk. And that is the basic reason behind the selection. Gynecomastia is a disease of the breast, and Lac-Human is prepared from breast milk. That's why Lac-Human is indicated. And that's why I have chosen these two medicine in cases of gynecomastia. And I really keen to know that, or I am really keen that you all people use these medicine in cases of gynecomastia, so that we will have a conclusion after 6 to 12 months that how effective these two medicines are. You can see on the screen, the second case is congestion of the lung. Congestion may occur as a result of infection. Congestion may occur as a result of pneumonia. Congestion may occur by any means. A collection of the fluid in the alveoli. So many causes are there. And we have seen previously in cases of corona, we have seen congestion of the lungs. So if there is congestion of the lung, the common symptom is breathlessness. A lady came to me, she was having congested lung. She was not able to breathe properly. And when I, auscultated her chest, I barely hear the sound. There was no sound at all. She was having dyspnea. She was not able to breathe properly. But fortunately, her oxygen level was not below 90. This was a relief for me. Have a look on the chest X-ray. Look at this. The whole of the lung is involved. There is, by default, there is slight amount of congestion, which usually present in the lower part of the lung. But if you see the upper and middle portion of the lung, the whole lung is involved, especially the right side, and also the left side. I have given her a medicine, and see this. If you see the follow-up X-ray, just see the name. This is the first X-ray. If you see the name, 70-year age, and in Feb, she came to me in Feb, and this is the follow-up X-ray, and she came to me at 28th of March, 70-year lady, and she was having great amount of dyspnea. She was not able to breathe properly, and I've given the medicine. And if you see pathologically, look at this. This is the first one, and this is the second one. She was having great relief. Few days before when she came to me, she was having great amount of relief. But what was the medicine which I have given to her? Have a look on this. Hepatica. Hepatica is a wonderful medicine in cases of hepatization of the lung. Whenever there is hepatization, whenever there is consolidation of the lung, whenever there is congestion of the lung, whenever you are not able to hear the sound with the help of stethoscope, when you don't have breathing sound on your stethoscope, then hepatica is indicated. Hepatica is indicated when there is congestion, when there is hepatization due to any means. And if there is absence of breathing, in case you can use hepatica in a 30 potency. I have given hepatica TDS. And Seneca is also there, which I have given to her. Seneca is a traditional medicine for clearing the lungs. Hepatica is also expectorant. Seneca is also a brilliant expectorant. So these medicines has been given to that lady, and you can see the results. Within 45 days, her lungs was clear and she was able to breathe properly. When she came to me at 28th of March, she was able to breathe properly. And when I went through the X-ray report, and you can see the clear, improvement in the X-ray as well. And I know that you all people are thinking about some other medicines like antim-tart and ipecac. Antim-tart and ipecac is also one of the great medicine for congestion of the lung. But as far as antim-tart is concerned, you all know that patient, there is no expectoration. There is no expectoration. And if patient expectorate, there is great amount of effort which is needed for the expectoration. And if there is small amount of expectoration, there is relief. So in hepatica, there is no expectoration. In hepatica, there is more congestion. In hepatica, there is more hepatization. So hepatica was given because of those reasons. So if you are using hepatica in such cases, I am pretty much sure that you will get the same results what I have got. Friends, look at this. Startling during sleep in children. It is one of the commonest problems in clinical practice. Usually when a child come to you or brought to you, why I'm telling brought to you? Because I'm talking about a child of 1 year age, 1.5 year age, 2 year age, 2.5, 3, 4 year age, and even a newborn child. If there is startling, so startling is usually present during fever. And most of the people, 90% of the doctor don't ask about startling. They ask about the thirst. They ask about the drowsiness, the restlessness, and what they, personally observe while watching that patient in their clinic. But most of the people don't ask about startling. So you have to ask that what happens during sleep. What happens during sleep? During sleep condition, there is any abnormal movement which is present? Most of the people don't ask. If startling is present, then what would be the medicine of choice? But before that, I would like to show you a video, a case brought to me, and I want to share you the video. Look at this. Oh, sorry. Sorry. I have to share some other videos. Sharing video of gangrene. 22. Yeah, look at this. Oh my God. Sorry for inconvenience. Desktop. Yes. Have a look on this video. Look at this. Watch this video carefully. Watch this. Look at this. Look at this. This is a startling. And in 20-second video, in 20 seconds, you have seen 2 times startling by that child. During sleeping, she was having, fever. She was having fever and she was having startling, I would like to share the second video of that child. Just after 1 day, when I prescribed the medicine, now you can see she have a proper sleep. She will not startle. In 1 minute video, in the previous video, within 20 seconds, you have seen that 2 times startling. At very next day, the fever went down and she was free from startling. She was having a proper sleep. Everything was good within 1 day. Look at this. No startling. You have to ask this. Whenever you have a case of fever, especially in children, you have to ask about startling. So what was the medicine which I've given? Have a look on the medicine. I'm going to show you. These are the medicine. Opium and Ginkgo metallicum 30. If you go through the literature of opium and Ginkgo metallicum, it is clearly written that opium is extremely indicated whenever there is startling, especially in children during feverish condition, during sleep. If there is startling, opium would be the medicine of choice. And same thing is written in Ginkgo metallicum as well. So you have to ask that if anything abnormal movement which is happening during the sleep, if a child comes to you suffering from fever, you have to ask this question. Because during sleep condition, there may be abnormal movement of the leg. If there is abnormal movement of the leg, Ginkgo metallicum is the medicine. If there is abnormal movement of the hand, what would be the medicine of choice? Calibro. If there is abnormal movement of the hand, Calibro would be the medicine of choice. If there is abnormal movement of the leg, Ginkgo metallicum would be the medicine of choice. And if there is a startling, which is present in child, opium and Ginkgo metallicum would be the medicine of choice. But I want to ask a question that why opium in 30 potency? If you have to give medicine for providing sleep to the patient, if you have to give medicine providing sleep to the patient, if patient is sleepless, if there is sleeplessness, on those cases, opium, if indicated, would be applicable in a lower potency. And if you have to give medicine for sleepiness, if there is excess amount of sleep, if you want to reduce the sleep, then opium would be indicated in 201 potency. So in this case, you have to add more sleep to that patient because somewhere the child was disturbed, there was she was not having a sound sleep. That's why opium was prescribed in a lower potency, and similar thing with Ginkgo metallicum 30. So opium and Ginkgo metallicum is a wonderful medicine. Whenever a case comes to you suffering from fever, and if there is a startling, then this medicine will be given to that patient. Oh my God, rheumatoid arthritis. Again, I'm going to show you an incomplete case. Rheumatoid arthritis is one of the difficult cases present, And if you have a case, you all know that rheumatoid arthritis is a disease which is autoimmune in nature. And you all know that autoimmune disease, what do you mean by that? It clearly means that your own cell are forming antibody against yourself. And this is the syphilitic condition. And if we talk about the first observation of Kent, what is the first observation of Kent? Prolonged aggravation and final decline of the patient. Prolonged aggravation and final decline of the patient. And I think rheumatoid arthritis has to be categorized under the first observation of Kent. Because there is no treatment available for rheumatoid arthritis, most difficult disease to cure because it is autoimmune in nature. But I want to show you the report. Have a look on this. If you see the report, the RA factor is 390. And when that lady came to me and I have given the medicine just after 40 days, look at this. When I went through the report of RA factor, it is above 100. But if you see just below rheumatoid factor RA, where it is written, exact value is 114 international unit per ml. Great relief. It was a brilliant, result. She was taking allopathic medicine. And one thing which I really want to make you know about that, if a person is taking allopathic medicine in cases of rheumatoid arthritis, I know that all the people taking who is suffering from rheumatoid arthritis, prednisolone or some of the steroid. So you don't have to stop the medicine immediately. Gradual withdrawal of the medicine will be recommended rather than immediately stopping the medicine, because patient is habituated. There is exquisite pain. Patient is tossing in agony. There is involvement of the small joints. You all know that there is a stiffness of the joint. There is involvement of the multiple joints. The patient is tossing here and there. There is great pain. On those cases, you have to gradually withdraw the allopathic medication. But the question is, what was the medicines which I have given? I have given prednisone 6. Prednisone 6 is a homeopathic medicine prepared from the synthetic source. I have given this medicine BD. Prednisone 6 was given BD, and I also given guaiacum tube, TDS. Prednisone is a new medicine for me. And I'm using this medicine since last few months, 2 or 3 months. 2 or 3 months, I have started using this medicine. And that's why I'm showing you the incomplete case, because I've shown you in the previous, in the previous report, the RA factor was 390. And in the second report, it is approximately 140. It was amazing. And I also want you people to use this medicine in a lower potency, because prednisone is not effective in 200 potency. Prednisone is not effective in 30 potency. Prednisone is effective in 6 potency. Not only in rheumatoid arthritis, but all the other autoimmune diseases. You have to use prednisone in lower potency. And I'm pretty much sure that after 6 to 12 months, we will have a conclusion regarding effectivity of these medicine in cases of different type of autoimmune disorders, especially rheumatoid arthritis. So when I have given prednisone 6 to her, within 40 to 45 days, she was having great amount of relief in the pain, relief in the stiffness. I'm not telling she was completely relieved, but she was having pain, but the pain was tolerable. The stiffness was tolerable. And she was considerably living a good life, what she was, living previously. But after the induction of prednisone 6 and guaiacum Q, this medicine has been given to her, and I think the result was amazing. So I also prefer these two medicines to all you people. Use these medicines in cases of rheumatoid arthritis, and let me know that what is the effectivity of prednisone 6 and guaiacum. There are so many other medicines which are also applicable, like Acti spicata, because a small joint is usually involved in rheumatoid arthritis. And one more medicine is ammonium phos. Ammonium phos is indicated whenever there is different type of deformities, bottom-ear deformity or swan neck deformity or jet deformity, where there is formation of nodule in the fingers, In those cases, ammonium phos is also indicated. And one more medicine is there, Stellaria media. Stellaria media is also there. But as far as the effectivity of prednisone 6 is concerned, I think prednisone has to be on the top place. So these two medicines has been given to her, and I think she was having great relief, both in the pain as well as stiffness. Moving to the next one. Oh my God, bleeding hemorrhoid. Simple case. And I know that you all people having frequent encountered with bleeding hemorrhoid, and in more than 85% of cases, in first prescription, you have relief. In more than 85% of cases, you got relief, after using medicines which are applicable in cases of bleeding hemorrhoid. And you can see on the screen that hemamylase is there, sulfur is there, Nux vomica, Ficus religiosa, millefolium, abrotenum, collinsonia, phosphorus. There are so many other medicines like abrotenum, like sedum acre. These are also applicable in cases of bleeding hemorrhoid. But I'm not here to make you know about the common thing. I'm here to make you know about the 10% of cases out of 100 cases, 10% of cases where you have not got the result. I'm talking about bleeding hemorrhoid. So what would be the medicine of choice? What medicine which you will prescribe even after selecting all these medicines, all the other indicated medicine, and if you're not getting result in bleeding hemorrhoid, you have to use carcinosin. Carcinosin in 1M potency. I want to ask a question from myself, that why carcinosin, why not something else? Why carcinosin is indicated? So when we talk about the pathology of carcinosin, so carcinosin having destruction of the blood vessels, carcinosin having action on the blood vessels, carcinosin causing destruction of the cells. Carcinosin is also indicated on, or you can say it is also applicable in the disease of the hemorrhoidal vein. And one more thing, that when well-selected medicine fails to act, you all know that sulfur is indicated. When sulfur fails to act, sorinum is indicated. When sorinum fails to act, tuberculinum is indicated. And when tuberculinum fails to act, carcinosin would be the medicine of choice. So these are the two reasons. Because of that, I have chosen carcinosin. The second question is, what is the repetition of carcinosin? So what I do, I'm going to explain you. Carcinosin 1M, first day you have to use 2 doses, means BD. From the second day, you have to use carcinosin 1M OD for 3 to 4 doses till the stoppage of bleeding. Let me tell you one thing. I am telling you with great amount of responsibility that carcinosin will stop the bleeding in 9 out of 10 cases. In which 9 out of 10 cases? The 10 cases which you have not got the result, even after using the most indicated medicine. So on those 10 cases, out of those 10 cases, you will get result in 9 cases by using carcinosin 1M. So carcinosin 1M is a wonderful medicine for bleeding hemorrhoid. One thing which I also want to tell you, that don't use carcinosin 1M as a primary option. Always use the other indicated medicine in cases of bleeding hemorrhoid. When you not get the result, then use carcinosin as a terminal option, the last option. And carcinosin will definitely not let you down. Right from the starting of my presentation, I'm talking about medicine. I'm also talking about the special potencies. So why I'm also making you know about the potencies? Without potency, a medicine is like chicken curry without chicken. There is chicken curry, but there is no chicken. Similarly, if you have selected the medicine, but you have not telling the potency, it is similar to that. There is no value, because selection of the medicine is a difficult process, I know that. But selection of the potency of that medicine is even difficult. Because as far as selection of the medicine is concerned, you have so many tools. You have symptoms. You have totality of symptoms. You have repertory. Even in one-sided disease, you have one or two symptoms. If symptoms are not present, you can observe something in the patient. But what about the potency? Even Dr. Henneman has told that if you want to select the potency, you have to select with your own. Use your experience. And that's why I'm very much particular about the potency on your screen. Just you can see that same medicine in different potencies applicable in different diseases. What I mean to say, same medicine in different type of potencies, they will be applicable in different type of diseases. Let's have some of the examples. In cholera, when veratrum album is indicated, cholera, there is vomiting, there is diarrhea, there is coldness of the body, there is drowsiness, there is, perspiration, cold perspiration. When veratrum album is indicated, you have to prescribe veratrum album in a 30 potency. In a patient having cholera, if veratrum album is indicated, you have to use veratrum album in a 30 potency. It will not act in 200, it will not act in 1M. It will better act in 30 potency. The second example, veratrum album 200, when indicated, will be extremely, efficient, extremely good as far as the action is concerned in bronchitis. If a patient comes to you having bronchitis, there is cough, there is dyspnea, there is expectoration. If veratrum album is indicated, you have to use veratrum album in a 200 potency. It will not act in 30. It will not act in 1M. It will better act in 200 potency. Similarly, veratrum album 1M. If a patient comes to you suffering from left-sided sciatica, I'm not talking about the simple pain. Remember, I'm not talking about the simple pain. I'm talking about the exquisite pain. Patient is tossing in agony. Patient is walking here and there because of great pain, because of intensified pain. The patient is weeping. The patient cannot tolerate the intensity of the pain. On those cases, in left-sided sciatic pain, when the character of the pain is matting type, veratrum album in a 1M potency with frequent repetition, tedious. Even in some cases, you have to use veratrum album at 2-hour interval. So veratrum album will be applicable in 1M potency when we are talking about left-sided sciatic pain of matting character. The veratrum album 30, veratrum album 200 will not act. Veratrum album 1M will act. So what we have seen, same medicine, different potencies, when indicated, will applicable in different type of diseases. Different potencies will be applicable in different type of diseases. So friends, whenever you are explaining something, you are telling something, you are, while taking a lecture, while, in a seminars or webinars, always mention the potency. Because as I've told you in the beginning, that we have to become truth teller. We have to be free from hyperbolism. We have to be accurate, and we have to share the accurate information, what we are experiencing in the clinic. Then these information will be helpful for everyone. Okay, this is a stroke. I'm talking about stroke, as you all know, that a sudden onset neurological deficit of vascularology. And you all know that there are two types of stroke, the hemorrhagic stroke, and one stroke is ischemic stroke. In hemorrhage, because of mechanical pressure on the walls of the vessels, there is rupture of the walls and there is bleeding. And in ischemic stroke, as you all know, that because of mechanical pressure, by the blood on the walls of the vessel, there is friction. Because of friction, there is rupture of the atheromatous plaque. Because of rupture of the atheromatous plaque, there is stimulation of thrombosis. And because of thrombosis, there is stoppage of circulation on the particular part of the brain, because we are talking about a stroke. So that stroke is ischemic stroke. So I want to show you a video. Have a look on this. If you see that old person, see the mouth. The mouth is deviated towards the right side. This case is not related to Bell's palsy. This is not a case of Bell's palsy. This case is related to a minor stroke, because that old people having stroke 2 years back. Right side was involved. He was having right-sided hemiplegia. And when he was having, few days before, he was having the same symptoms starting from the mouth. He became extremely anxious and he went to me, Dr. Sahab, do something for that. So have a look on this video. I'm going to show you the video. Look at this. This is the first video. Have a look. If you see the mouth, you have to see the mouth.
ये जो है आपका मुंह कब से खिंचा रहा है? इधर कै दिन से?
या 20-25 दिन से खींचा रहा है।
दाहिने तरफ खिंचा रहा है ना?
हाँ, यही
Look at the
दिख भी
mouth.
रहा है।
Deviated towards
चलने
the right
फिरने में
side.
बैलेंस भी बिगड़ जा रहा है।
And balance was also disturbed.
बाकी
He was
और कोई
not able
दिक्कत
to
है?
walk properly, and there was
मुंह
abnormality in
खिंचा
the
था और
voice
बैलेंस
as
बिगड़ा
well.
था।
He was not able to
2
speak
साल
properly.
पहले
There was
आपको अटैक आया था
blurring of voice.
दाहिने साइड,
दाहिने साइड।
पूरा मार दिया था।
हाँ, पूरा दाहिने साइड मार दिया।
He was
आज ही सीटी स्कैन कराए हैं 2 मार्च को।
having a stroke, right-sided hemiplegia. So he was having, deviation of the mouth towards the right side. There was loss of balance, and the voice was also slurred. There was motor aphasia. As you all know, that motor aphasia is what is motor aphasia? Patient can apprehend what is being told to him, but patient cannot articulate properly. He can understand what is being told to him, but he cannot articulate because problem in the Broca's area, the motor speech area. Just look at the second video. Look at the second video of that patient. Just after 15 days, see the mouth. Have a look on this.
बात कीजिए ऐसे।
In the previous video, you have seen that there was deviation of the mouth, but in this video, just see there is
1 रुपए में कितना ठीक है अब?
1 रुपया में जैसे कि 4 आना तो ठीक है।
अच्छा, और खींच रहा था मुंह वो उधर की तरफ?
हाँ,
अब वैसे ही खींच रहा है या क्या है?
नहीं, कुछ कम होगा।
कम खींच रहा है।
जी हाँ।
और क्या क्या आराम है?
और खाली जो झाई आता गिरे गिरे हो जाता नहीं, वो आराम है।
अच्छा, लग रहा था कि गिर जाएंगे।
हाँ,
वो भी आराम है।
हाँ, वो आराम है।
अच्छा, कुछ आवाज कैसा है पहले से?
आवाज किस पहले से ठीक है।
पहले से साफ आ रहा है?
हाँ जी।
अच्छा, ठीक है, ठीक है।
He's telling that
CT scan
his
लीजिए
voice
तो
is
अपना
good.
निकालिए।
Now he can speak properly. In the previous video, he was not able to speak properly.
उसकी रिपोर्ट भी दिखाइए।
After the homeopathic medicine, now he can walk. He can walk properly, he can speak properly. And one more thing, you can see the mouth. The mouth is symmetrically open. This is the report, CT scan report. So it was a case of minor stroke. Now coming to the slide, what was the medicines which I have given? Let's talk about that. Kali cyanide. I have already mentioned about these medicines, causticum, Kali cyanitum, and Califos. Kali cyanitum is indicated when there is right-sided hemiplegia with aphasia. It is also indicated when there is right-sided hemiparesis with aphasia. It is also indicated in, when there is motor aphasia and when there is minor stroke even. Kali cyanitum is extremely effective. If you go to the literature of Kali cyanitum, is Boric Materia Medica, it is clearly written that patient can apprehend what is being told to him, but patient cannot articulate. So Kali cyanitum is always indicated. Whenever you have such symptoms, you can prescribe Kali cyanitum. Causticum is also one of the best medicine for both sided of, a hemiplegia, right sided or left sided, but causticum is usually indicated in right sided hemiplegia. And when we talk about the aggravating factor of causticum, you all know that the symptoms of causticum aggravate in a clear, fine weather. Whereas in causticum, the relief of pain, the relief of symptoms, the relief of anything in a foggy weather, when there is moistness in the weather, in a rainy season, there'll be relief. But in a clear, fine weather, all symptoms of causticum will aggravate. And you all know that Kali Phos is a traditional medicine for, nerves. Any problem of the nerves, Kali Phos is indicated. So Kali side, these medicines have been given to him. And one more medicines which I really want to focus upon is arnica. I always tell the people that arnica is always indicated in hemorrhage. It is always indicated in ischemic stroke. Why? Because in even brain, as you all know that in arnica, it is written that arnica is applicable in blunt injury. Whenever there is a blunt injury, arnica will be indicated. And one thing which I really want to admit, that arnica will be indicated in higher potency when you have a case in acute form. If patient come to you immediately after the attack, immediately after the injury, you have to prescribe arnica in a higher potency. Arnica in a higher potency will be more applicable. But why in hemorrhagic stroke and why in ischemic stroke? Because what you have seen, that case was a minor ischemic stroke case. So arnica is indicated because why there is hemorrhage in the brain? Because of atherosclerosis. What happens after atherosclerosis? There is narrowing of the blood vessels. What happened after narrowing of the blood vessels? The lateral pressure created by the blood on the walls of the vessel increases. And that is the mechanical pressure created by the blood. And because of mechanical pressure, there is rupture of the blood vessel. And that's why and there is no shape of blood. So that is also considered under blunt injury. Similarly, in ischemic stroke, there is formation of thrombosis. And why thrombosis forms? Because of some of activation of the clotting factor. Why clotting factor are activated? Because of friction, because of hemorrhage in the blood vessels. Why there is hemorrhage? Because of friction. Why there is friction? Because of narrowness of the blood vessels. Because of friction, the atheromatous plaque rupture. There is bleeding. There is release of some clotting factor. There is formation of thrombosis, and ultimately there is ischemia. And because of ischemia, there is infarction. And what is a stroke? It is a sudden onset neurological deficit of vascular etiology. So always remember that you have to use arnica in every case. Whenever a case comes to you acutely, give arnica in a higher potency.
Excuse me, doctor, how much time you needed?
But I'm about to complete, sir.
Yes, our custom is we have 15 minutes discussion.
Within sir 3 minutes. Within 3 minutes,
Okay,
if you allow me, sir.
Yes,
if you allow me within 3 minutes, I'm going.
Yes, okay. Yes, please proceed.
Thank you, sir. Thank you very much. Osteoarthrosis of the knee joint, one of the commonest problem in clinical practice. Only with the help of medicine we cannot cure, we cannot improve osteoarthrosis. We have to do some of the management, and I have already mentioned in my previous lecture in this forum. I have already mentioned about the management portion, that we have to use the knee braces, we have to use a special type of shoes, everything I've mentioned. But today I'm going to tell you about some of the medicine which I used in cases of osteoarthrosis. Look at this. There are so many medicines like cannabis sativa. Cannabis sativa is indicated whenever there is, subluxation of the joint. If what is subluxation? During walking, if a patient will tell you that, doctor, it seems as if my joint will break like this. During walking, if there is dislocation like feeling of the joint, then cannabis sativa will be indicated. And you all experience, you know that most of the people will tell you that, doctor, I'm having subluxation of the joint while walking. The second medicine is Malleolota alba. Malleolota alba is also indicated in osteoarthrosis in most of the cases. Osteoarthritis nosode. Osteoarthritis nosode is a new medicine which I am using since last 7 or 8 months. I'm using osteoarthritis nosode in a 12 potency. It is not effective in 30, it is not effective in 200, but it is extremely effective in 12 potency. The fourth medicine is Argemone mexicana. Argemone mexicana is specially applicable for left-sided knee pain, whereas jacaranda in a lower potency, in 12 potency, is more effective in a right-sided knee pain. And there are so many other medicines which you can see on the screen, like Cassia sophera. Cassia sophera having similar symptoms. If you compare Cassia sophera with Rustox, you will have the same symptoms. First motion aggravation, continuous motion amelioration, and prolonged motion aggravation. But when a person comes to you having cervical spondylosis, and that patient also having pain in the knee, I think the single medicine will be Cassia sophera. Cassia sophera is an amazing medicine for cervical spondylosis when vertigo is present. Amazing medicines. And I've already mentioned about so many other medicines like oxytropis, sulfonol, Cocculus indicus. And one of the prominent member of that family is Cassia sophera as well. So Cassia sophera is a brilliant medicine for cervical spondylosis when vertigo is present. And it is also amazing medicine for pain in the knee when the symptoms are very much similar to Rustox. And so many other medicines which you can see on the screen. These medicines are frequently used in my clinic. But the medicines with red having yellow background, cannabis sativa, Meliolotus alba, osteoarthritis, Argemone, jacaranda, and Cassia sophera, they are extremely effective. Along with management, if you use this medicine, I think you will have a desirable results. Thank you, ladies and gentlemen. Thank you for this opportunity. Thank you for giving me this wonderful,
Yes. Thank you, Dr. Vijendra. Nice presentation. Time for discussion. Those who would like to participate, please raise your hand. You can ask some questions or you can add something to this wonderful presentation. Specificities. And also he presented a much practical way of therapeutics. New medicines, new generation of medicines were also discussed. So that will further add to the homeopathic armamentarium. Everybody knows that. The time of Hahnemann, he brought 99 medicines. Now it reaches more than 3,000 to 4,000 medicine. So all these indicate that homeopathy is growing. How these are happens? Because of the this consistency in study as well as research work. It is there. But there is no Nobel Prize, no Nobel kudos for the physicians who are doing all these things. And also these are not just published in newspapers because of lack of money. It's not in the television channels, so nobody is discussing. At the same time, all are focusing upon unwanted medicines. We know that around a dozen of medicines were used, said to be very effective in containing corona. From HCQ to another dozen of medicine, what happens? But still they are considered as very effective, very practical method, very scientific methods. It makes the...
Thank you, sir. Thank you. Thank you
Now,
very much.
Dr. Dhanesh is there. He's the program coordinator doing all these works. Dr. Dhanesh, please.
Good evening, Dr. Vijendra. It's really a very good session. You really speak from your heart. That's the beauty of your session, because you want everyone to be a very good practitioner, and that's the reason why you're talking which are the potency which are effective for a person who can handle in different cases. That is very important, because choosing a potency at the right time will definitely click the result in the shortest possible time. But the thing is that most of the people hide those experiences, and they believe that it is my private property. But you are a different person. You really come out here and spoke from your heart. That's what I would like to say. All the cases you discussed here were really brilliant. Nobody could believe that such a thing will happen with our single remedy and in one single doses, and even you have a method of your own, when to repeat, how to repeat, and why repeat. Some people believe that it will you will get the result if you wait and wait. But you from your experience, you have found a combinatory method, that is giving this kind of medicine in every 4 week or every 4 days or 10 days or so. That's because of that's why each and everyone's experience is very relevant as far as we are concerned. And thank you for such a beautiful session. Hope that you can, because we are uploading all these videos from the very next day itself. Naturally, it will reach to the public also, so that people can see what is happening with the homeopathy in those conditions which are supposed to be incurable, or there are no result. Still, the patient is a patient who is undertaking such treatment is always a patient. But your method is entirely different. And anyway, congratulations once again, doctor.
Thank you, sir. Thank you, sir.
Yes, I think our Ram Parvez, our doctor, is ready to talk. Yes, yes, please, sir.
Thank you, Manoj ji. Congratulations, Dr. Vijendra
sir.
Pratap ji.
Thank you, sir.
Very nice presentation. Excellent session. Therapeutic approach of homeopathy.
Thank you, sir.
Hemiplegia, osteoarthritis. Beautiful describe and selection of medicine.
Thank you, sir.
Very thanks.
Thank you, sir. Thank you, sir. Thank you.
Yes, you said about this gynecomastia case where you took the symptom bashfulness, very logical one, and it is quite natural that all these persons will develop such a symptom. They are really worried about, they are struggling from that problem, and fortunately that patient is rescued by your logic. That's the most important thing. There is no other options to contain this problem. That's a wonderful case. The second case is congestion of lung. There also you done a pathological consideration and you gave the hepatic 30th potency that acted well. You all know that the potency selection, the lower potency will naturally produce symptoms on tissues, more in the tissue level. Then another startling case. There is a doubt you said about the child was sleeping, startling during sleeping. But that video, it showed that it is still open the child, and that the second video, I think the child was not sleeping that time, or the child is asleep with half opened eyes. What is that? That is
actually that case was related to my family.
Yeah.
Very, what I always believe in telling truth, sir. So that case was related to my family, my niece.
Yeah. Okay. Then the prednisone 6. What about the side effects when you administer such medicines with the homeopathy preparations? What you are expecting there? Did you observe anything like that?
I'm sorry, sir, I couldn't get your voice properly.
Yes. You prescribe the prednisone tablet, the medicines in the 6th potency.
Yes, sir.
You all know that all allopathic medicines are often creating these so-called side effects.
No, prednisone 6 is a homeopathic medicine, sir, not allopathic medicine.
What is the source of that medicine?
Prednisone 6 is a medicine which is prepared from synthetic source.
What is that?
There are 7 sources, no? Vegetable kingdom, animal kingdom.
No, I am not mentioning about the source. What is it allopathic medicine you potentize or not?
Potentize, no? 6 potency.
The allopathic medicine, isn't it? Am I right?
The prednisone is prepared from the synthetic source. It is a homeopathic medicine.
I am not asking about the source, not the preparation. But what is the substance of prednisone?
I'll make you know later, sir. Substance.
Okay.
Yes. But during study of Materia Medica, I found prednisone 6 and when I go to Murphy Materia Medica, sir. In Murphy Materia Medica, prednisone is written.
And there is a wrong practice or method. I suspect that the so-called tautopathic method, because of the not understanding what Hahnemann mentioned. Hahnemann mentioned similarity in symptoms while differing in kind. So it is not at all always to make such medicines from the allopathic medicines. I think that we should keep a word of caution there. It's time for conclusion. May I invite Ram Pravesh Shah, sir, to express a lot of thanks.
Okay.
Dr. Ram Pravesh Shah, sir, are you there? Yes, I think
Yes,
patient
sir. Yes.
kindly express a lot of thanks to our Dr. Vijendra Pratap, the talented person. Yes, sir, please.
Thank you, Dr. VIJENDRA Pratap ji. Thank you, behind of IFPH. Again, presentation, dynamic presentation. Every presentation is a dynamic. Very, very
Thank
thanks.
Thank you, sir.
Okay, thank you. That indicates when you take homeopathic medicine, you should take the medicine highest potency. I hope so. With that remark, let me conclude today's English edition, day 1307. We'll be back again tomorrow. Till then, goodbye, and Dr. Shaila to continue the program in Malayalam. Thank you.
Thanks.
Okay, thank you, Dr. Manoj. Thank you, all doctors in